Hey drivers, Dr. Nuesse here again, and today I want to talk about a pretty big change that the Department of Transportation, the FMCSA, has made as it pertains to insulin-dependent diabetics and their certification to drive commercial vehicles. So it used to be the case that insulin-dependent diabetics would be disqualified across the board. Insulin dependence would disqualify you, would be a disqualifying factor. You could not be certified to drive a commercial vehicle. That is, unless you could then obtain some federal exemption. So they recently have made a change, and for once it's actually a change that benefits the driver. Now, instead of being disqualified across the board, if you are insulin dependent, if you are a diabetic that takes insulin, and you are a commercial driver, what you will need to do is within 45 days of going to see your certified medical examiner who's going to perform the DOT physical, you will need to take a form and have it filled out by your treating physician, whoever treats you for your diabetes. And then based on this information, we may be able to then certify you to drive commercially. All right, I want to show you the form because I think it is important. There are a couple key points on there, and I want, don't want there to be any surprises. So I'm going to take you through step by step the form. Before I do that, I want to encourage you to please subscribe to this channel. I'm making updates whenever the FMCSA comes out with new stipulations. I want you to be informed, and consider sharing this with other drivers who you think may benefit from it. All right, let's look at the form specifically. Okay, so this is the form that you are going to want to take to your treating clinician. Insulin-treated diabetes mellitus assessment form. It's also known as the MCSA-5870 form. All right, so what they are looking for is a few different things. So they are going to fill this form out. What you're going to need to have is you're going to need to have 3 months of blood glucose self-monitoring record. So without that, you can get an extension to drive, but eventually in order to get your certification, your full certification, you're going to need 3 months of ongoing blood glucose self-monitoring records, and you're going to need to take those to your treating physician. All right, so they're also going to want to know how many times a day you're testing your blood glucose. Has the individual been compliant with glucose self-monitoring? Basically what they're trying to figure out is, are you staying up on, is your blood glucose controlled or not? Because this can lead to severe events. Again, down here, number 6, severe hypoglycemic episodes. Have you had any severe hypoglycemic episodes? And what they are counting as severe is that you required the assistance of others, or you lost consciousness or had a seizure. Obviously, these would be very bad things if you were driving. They're going to want to know your hemoglobin A1C measurements. And then there's diabetes complications. So do you have signs of diabetic complications that target organ damage? Now, if you are in renal failure, kidney failure, based on your diabetes, that is going to be something that will disqualify you, and you will not be able to be certified. Do you have diabetic cardiovascular disease? Do you have a neurologic disease, autonomic neuropathy? Do you have peripheral neuropathy? Again, severe peripheral neuropathy is going to be something that would disqualify you. Let's skip down here to progressive eye disease. Has the individual been diagnosed with either severe non-proliferative diabetic retinopathy or proliferative diabetic retinopathy? If you are stage 3 or stage 4, and you have stage 3 or stage 4 retinopathy, you are going to be disqualified. That's going to be still a disqualifying factor. Have you been diagnosed with any other progressive eye disease? Again, vision, something very important when you are driving. Any additional comments, and then the treating clinician will then sign off on this, and then you will bring this to your certified medical examiner during your Department of Transportation physical. And then we will use this information to determine if it's appropriate for you to be certified to drive. All right, I hope that was helpful. Again, a couple key points with this is this needs to be taken to us. This form needs to be filled out within 45 days of your Department of Transportation physical. You need to have 3 months backlog of blood glucose monitoring taken to your treating clinician so they can fill this out, and you've got to be aware of some of the disqualifying factors. Diabetic retinopathy being one, severe peripheral neuropathy being another, renal failure, kidney damage, that being the other. All right, I will catch all you drivers next time.